Are you looking to treat your IT band syndrome at home? In this video today, I'm going to show you 2 exercises that are key for you to be doing to fix your IT band syndrome at home. And I'll also be showing you 2 stretches that you should absolutely avoid doing because it's going to make your IT band syndrome worse in the long run. My name is Dr. David Minoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please subscribe so that you don't miss out on any of the videos that we upload every week. Now let's get into the 2 exercises that you absolutely need to be doing for IT band syndrome. The first one is called Clams. You're going to need to lie down on your side to do this. I'm going to show you just like so. You can be flat or with your hand under your head like so. I'm going to just hold my hand under my head, but you could put a pillow under your head or just lie like this. What you've got to do is target the muscles that are more on the back side of your hip. If you've got IT band syndrome, you know that your hip is going to be tight here on the front, maybe the outside of your thigh, and usually on the outside of the knee is where people feel it the most. So you want to avoid using any of those parts that feel painful or tight. You actually want to not feel it there. What you do want to feel is the muscle more on the butt side back here rather than the front of the hip or the outside of the hip, but in the back. And to do that on this clam exercise, you've got to keep your legs kind of even with each other, well, right on top of each other, knees softly bend. The angle isn't too important. You find out what's comfortable for you. Usually a little straighter more than bent is going to be better for specifically for IT band syndrome. But then what you're going to do, this is the key part of this clamshell exercise. This is where people do it wrong all the time. You've got to roll your hips forward like this. You see how my chest and my hips are kind of coming forward? That causes this top knee to stick out past the bottom knee. What's usually taught in physical therapy by physical therapists or other people that teach clamshell exercises is to keep your hips even with each other. In other words, vertical in this position. And then they'll teach you to open up your leg like a clamshell exercise is typically done. But what I want you to do is make sure that you feel it back here more on the butt cheek. So to do that, you've got to roll forward just like so. You can even put your hand back there, kind of like where your back pocket is or would be if you had on pants with pockets. Then you're going to lift up your leg and hold it there. You've got to hold. That's another important thing. People will typically just come up and down without holding, but you've got to come up there and hold it for 10 seconds so that you feel it in the back pocket area over here. After about 10 seconds, come on down and repeat that. If you don't feel it the first rep or 2 or a handful of reps, that's okay. Keep going and target the muscle back here where your back pocket would be if you had on pants with pockets. And just do it again. Take a little rest break every 10 seconds or so. And I'm looking with my eyes at my kneecaps right here to make sure that my top leg is sticking out more forward than my bottom leg. And it shouldn't hurt. It shouldn't activate this front. If you do feel like this is tightening up on the front, you're doing something wrong. You got to start over again, set up. You might even need to roll over. Some people, no joke, here in the clinic, we're telling them to bring their chest flat onto the ground and then lift from there just like that. And they can target their butt muscle best from this position. Now, how high you lift your knee isn't as important as that you feel it in the right spot. Actually, what tends to happen is if you go higher, your hips start to roll backwards, and then you start to use those muscles that I'm telling you not to use. The TFL muscle right here that attaches into the IT band, then you'll feel the pulling to the IT band into the knee. And that's going to feed into the problem. So you don't want to do this exercise incorrectly. You've got to make sure that you fire that butt muscle back here. The gluteus medius and maximus is what we're trying to fire here. As far as foot position, you can point your toe up. That tends to make it a bit harder. You can relax your foot. Just make sure that you're trying to lift that knee and keeping it forward here. So the way to do this, as far as the frequency, the reps and sets, if you've got IT band syndrome, I would be doing 10-second holds 10 times. And then you need to look at doing this multiple times a day. If it's severe, I would be doing this every 2 to 3 hours while you're awake and making sure that you get fatigued and even a bit sore if you can back here. At the very least fatigued, make sure that you target that butt muscle back here. The second exercise that you need to be doing for IT band syndrome is butt blasters. And this is another one that's going to tire out that same spot in your butt when you were doing that clamshell. but it's a more focused way to do it in a different position. You're gonna have to stabilize your core a bit better. So I like that because your core stability, your lumbar spine and pelvis stability is really important to make sure that your hip moves well, which translates to good knee motion. And if you're moving well and you've got good strength in those areas, then you should theoretically not have any problems like IT band syndrome, or runner's knee is another common name for it. So let me show you the exercise. You're gonna get on all fours, be on the floor again or your bed. Then what you've got to do is suck in your abs a bit, just stiffen up right here so that you're more stable. Hold that the whole time. Then what you're gonna do with one leg is start to straighten it out, but think about tightening your butt. Notice my knee is still bent here. I don't care how straight the knee is. What I care about is the butt muscle right in here is working hard. Once you've got your leg tight right here, then what you've got to do is begin to turn your knee outwards while still maintaining your butt tight. So just to show you in slow motion, I'm gonna come up, squeeze the butt muscle really hard here, then turn your knee out and hold it right there for 10 seconds. Count to 10, and I can tell you it's already burning right here. It's blasting that muscle for sure. And it doesn't matter if your knee's straight. It's actually easier if you bend your knee because it makes your leg longer, which is more effort to control out here. So if you feel like you need to straighten out your leg to make it more difficult, then do so. After about 10 seconds, then bring that leg in and alternate. You should do both sides. Tighten that butt muscle on the right side now, then turn your leg out. Keep your abs tight and hold it right there for 10 seconds. And think about squeezing your butt muscle on the leg that you're picking up as hard as you possibly can. After about 10 seconds, come back to the other side and repeat this. Sorry, let me stabilize my abs here. Abs tight. Okay, now I feel it. Repeat this 10 times each side. So you're gonna do 20 reps total, and I would do it along with that clamshell every 2 to 3 hours. If you're not that severe in your IT band syndrome and the pain and irritation that you might be getting on your knee and hip area, or on the outside of your thigh, then you probably could get away with doing less of this, but I would still encourage you to do quite a bit of strengthening here in this area. And realize too, this is the first couple of exercises that we give somebody with IT band syndrome. We have to progress strength in those glute muscles properly in order to get them to the point where, to get a patient to the point where they're not thinking about their IT band syndrome. It's not a recurring thing where they truly have cured the problem, where they have a long-term relief, and it's not coming back every time they go run or go cycle or go walk or just be on their feet for an extended period of time, because that's when the symptoms will tend to come back. So you've got to increase your strength from these exercises, but these exercises are great starting points. They can definitely diminish down the pain, the discomfort from the IT band syndrome, and it can set you up to cure the problem for the long term. Now let me tell you 2 stretches that you absolutely need to avoid. Notice I showed you exercises and I'm telling you not to do stretches, because stretches are rarely ever needed for anything. I hardly ever prescribe stretches to anybody, less than once a year. I can't even remember the last time I gave somebody a stretch. It's overdone in our culture, in our health and fitness world. Stretches rarely ever need to be done in order to fix a problem. I'm not saying stretching is bad. It's okay to stretch from time to time, or if you stretch in the morning or you want to stretch here and there. But if you're stretching with the intent of fixing this IT band problem, I think you're going to find that it's not going to fix it. It might just give you some temporary relief. There's more about that in another video that we've got. You can check out our channel, subscribe to our channel to make sure you don't miss out on any of these videos. There's 2 types of stretches and they're done in different positions. The first one is called an adduction stretch. An adduction stretch is just moving your legs inwards to stretch out the outer side of your hip. The opposite would be an abduction, where you move your feet outwards and open up your legs. But typically when stretching out the IT band, people look to bring the leg across the body to the other side of the body. There's standing versions of this, there's sitting versions, and lying down versions. Let me show you some of the most commonly done ones. One that is recommended often by physical therapists is lying down on the edge of a bed or a table, and then if you're trying to stretch out this IT band on this side, then stretching out your leg, you're holding on to the table and just letting your leg dangle this way. And notice how my leg is coming across my body, and you should feel a stretch all the way up into your torso, but over through here. This is okay to do if you're doing it lightly. And there's standing versions of this. Let me just show you that real quick. People will usually cross their legs. So my right leg is crossed over my left leg, and I'm standing with my feet like this, and then they'll stretch out their body this way or even lean over quite a bit. They'll call this a ballerina stretch, or a half moon stretch is another one. It's a yoga move as well. And they're trying to create a stretch to that TFL muscle and the IT band. These are all different types of adduction stretches. They might provide some short-term relief, which is cool if you're looking to not take pain medications, or to maybe skip out on visiting the doctor for an injection. Maybe you'll get some relief. But if you're doing this on a regular basis with the intent of fixing your IT band problem, you're gonna not resolve it. It's going to actually get worse. There's something called the stretch reflex inside of our muscles that makes you want to contract your muscle when you put it through a big stretch, and actually makes the muscle stronger over time. You won't feel it if you stretch once or twice, or a handful of times, but if you're consistently stretching multiple times a day for days and weeks on end, then you're probably going to feel the effect of this IT band problem staying there longer than it should. The other common stretch that's done is a quad stretch. That's the front of the thighs. Let me show you how it's done. There's some where you're lying down, so just like this on your side, and then you're grabbing the back of you're grabbing your leg and pulling your leg backwards, bringing your heel to your butt just like this, and this is producing a stretch in this area. And the intent is to stretch the muscles near the IT band. Another one is just standing up. Same idea. Of course, you might be holding on to something for balance, and then you grab your ankle or your foot, and you bring your butt, your heel to your butt as far as you can to stretch the front of the thigh. The IT band has a muscle in it called the TFL, which I've mentioned, and that TFL muscle can act as a hip flexor. So the idea is that if you stretch out your quads, which some of them are hip flexors, they can help to lengthen the muscle. But again, if you're getting to that stretch reflex, and you can Google this, the muscle spindle is the little cells that are inside of muscles that they have nerves that connect to the spine, and they create something called the stretch reflex. There's something else called the Golgi tendon organ, and this is all sciencey medical terms. For those of you that are interested, you can go look it up. But it causes the muscle to want to contract, to shorten during the stretch, which indirectly strengthens it, and this makes the problem stay there longer than it should. The false sense of improvement, though, is that people like the stretch sensation, and especially when you've got a physical therapist or a trainer or some medical professional telling you, go stretch it out, and the harder you stretch, oh, doesn't that feel good? It hurts so good, right? That is a false sense of security. You're not going to improve for the long term if you're just looking to do that to fix your runner's knee or your IT band syndrome. Now, one question that I always get about the IT band is rolling it out. So I'm going to give you a bonus tip to treat your IT band problem at home, because I think rolling it out is actually not a bad idea in the short term. What is good about it is, of course, it's not fixing it for the long term. So don't go rolling it out thinking that that's going to fix it forever. You're going to just get some short-term relief, but it doesn't typically tend to set off the stretch reflex and cause you to work out the muscle more indirectly when you're trying to stretch it. So I like rolling it out for IT band, but it's really just looking at keeping you from taking more pain medications or visiting the doctor for injections. But you'll need some sort of cylindrical, stiff but padded device. We've got this roll here. I'll put a link in the description so that you can look at getting one yourself. A foam roller works well too. There isn't anything magical about these. There's a huge market for these now. They have all different kinds of textures and pads and shapes, and whatever works best for you is really what I'll tell people. We like this one. It has good durability. They last a while. The foam rollers, the white ones, or they make black and gray ones. I think they have all kinds of colors. Those just tend to get a little squashed as you use them more and more. I've only really seen them get misshapen in physical therapy clinics. People that buy their own typically don't use them that much that they get misshapen. In physical therapy clinics, when they're being used every day, every hour, multiple times an hour, then we see those get some mileage on them. But anyways, I'm going to show you what to do. So right where you feel the stiffness on your IT band and your quad, that's where you want to roll it. So put that under you. You're going to have to do a little bit of balancing here. right where your front pocket would be is where the TFL muscle is, and you just lean on it like that. You can control how much pressure you put with your arms and with your legs, and then you're just going to slide your body up and down over that tender area. It's tender in most people, even if you don't have a IT band syndrome. So if you've got IT band syndrome, expect it to be quite tender when you do this. You might want to even get off your elbow and just be like this, roll it out gently, and then to get onto the front of your thigh, let me just show you how my other leg. You'll just have to lie down, face down on the foam roller or the rolling device and use it like so. You just have to lie down, face down on the foam roller device and just roll up and down like so. You can go all the way down to right above your kneecap, and you can roll your body inwards or outwards to angle different positions on your thigh. Like I said, I can't stress it enough. This isn't going to fix you for the long term, but it might give you some short-term relief, because when you roll like this, it kind of massages your thigh muscles, your hip muscles, the TFL muscles specifically, and causes it to relax. As far as how long to use this and how intense to go, it's up to you how intense you want to be, how much weight you want to put through your body. I wouldn't do this for more than a minute per muscle or per area. Some people like to roll on this device for 15, 20 plus minutes. If you find that you get relief from doing that, by all means do so. What I find as a physical therapist is people get diminishing returns. After the first minute or so, there isn't that much more improvement for going 2 minutes or 5 minutes or 15 minutes. But if you've got the time, you've got the desire, you're getting the results that you're looking for, go for it. You can certainly do it. Now, one last piece I want to leave you with. If you're looking for a more comprehensive plan, one that takes you through the progressions for resolving your IT band problems so that you can get rid of that hip pain, that stiffness, and that knee pain, and get back to being active, healthy, and mobile again, then check out our 28-day knee health and wellness boost program. It's linked in the description below, and what it is, it's a 100% online, on-demand program that takes you through series of progressions for improving your knee health. If you've got IT band syndrome and you're looking at staying out of the doctor's office, you can't make it to a physical therapist's office, and you want some guiding and coaching and exercises to do for your IT band syndrome so that you can resolve it all the way, go check out this program. Click on that link, you'll get taken to a page that has more information about our 28-day program. Hey, drop a comment and let us know if you've been stretching to treat your IT band syndrome, or if you try these exercises that we've shown you today. Also, let us know how it's going. If you got any questions about using the foam roller or these exercises, please drop a comment. We're happy to get back to you as fast as we can. Thanks so much, guys, and I hope you have the best day. Bye-bye.